عليكم. السلام عليكم. We just finished the morning round. How are you?
Alhamdulillah.
Alhamdulillah, hoping to see you inshallah soon in the school. Maybe Allah subhanahu wa ta'ala give us forgive from this bad virus and from everything bad inshallah. Let us start by Al-Kitab. Bismillah ar-Rahman ar-Rahim. Okay, who will be the first one to present?
Me. Me.
Who is Ayman?
My group.
Sorry?
My group. We will present about dengue. Dengue
This
fever.
is I'm asking. Who is the doctor? Are you? You will be the doctor who collects the knowledge because I will give you the marks at the end.
I am the doctor.
You are the doctor?
Yes.
Okay. So Ayman, now you are going to discuss a case of fever. Yes?
Yes.
With rash. I'm just presenting you. Now you are going to collect the history from a case of fever and rash. You are getting 15 minutes to chat with your patient who is a role player. And then I'm going to discuss with you the case as if you are sitting in the exam. And then your colleague will help by presenting a lot of details. Okay? So start by your first part.
I will start. Assalamualaikum.
I mean to switch off my camera because internet inside the hospital is not so stable, okay?
Okay, okay. Assalamualaikum. Assalamualaikum Puan.
Waalaikumsalam.
Is this girl your daughter?
Yes.
My name is Dr. Aiman. Do not worry. We are all trying our best to treat her here. And therefore, I will ask you some questions to gain more information about your daughter's condition. Is it okay for you?
It's okay.
All right, thank you. And first thing first, may I know the reason why your daughter admitted here to this emergency department?
Okay, so my daughter has unresolved fever since 4 days ago, and she appear lethargy.
I see. Can you tell me more about this fever?
The fever was sudden onset because before this she was well, but suddenly she had fever since 4 days ago, and the fever was associated with chills and rigor. And I did give her paracetamol, but the fever is still unresolved. Maybe because she couldn't eat the paracetamol because I noticed that when she vomit, the vomits contain the paracetamol tablets.
I see. Have you taken the temperature of your daughter around these 4 days?
No, I did not, but she was warm upon touch, and also the fever was not relieved by tepid sponge.
I see. For the fever, is it throughout the 4 days high, or is it increased with certain pattern like morning high, or in the evening will be little bit less low temperature, or how?
Uh, the fever was persistent throughout the 4 days without any pattern.
I see. Have you taken your daughter to any to the clinic before?
No.
Yes, you never taken your daughter to any clinic before you arrive here.
I did. On the first day of the illness, I take her to the klinik kesihatan Beserah on the first day of the fever,
Uh,
and the clinic only took the blood sample for investigation and give the paracetamol tablets.
uh, does they take the temperature of your daughter at that time?
Yes, the temperature recorded was 39 degrees Celsius.
Oh, it is a bit high. Okay. Can I know more about? Is there any other symptom that related throughout these 4 days?
My daughter did complain of abdominal pain, uh, maybe due to the frequent vomiting, and she said that the pain was not persistent; it was intermittent, and also she did complain of headache. But this abdominal pain and vomiting and also the headache only appear on the first day of illness only.
Only on the first day. So on the subsequent day until today, there are no vomiting and cough like that.
No, only on the first day.
I see. For the lethargy, can you describe more on how she appeared lethargy in this around these 4 days?
She was unable to go to the school and only lie on the bed, and she slept throughout the day.
She slept throughout the day. Do you notice any changes around her eyes or her lips or her skin?
Yes, I noticed that her eyes were sunken, the lip and the skin also dry.
What about her urination?
Uh,
Does she keep urinating or keep going to toilet or somehow?
no, I noticed that her urination was also reduced, and she said that her urine was concentrated.
Concentrated, you mean become more yellowish, isn't it?
Yes.
Is she also said that there was blood in her urine?
No, she does not have blood in her urine.
Do you notice any weight loss of your daughter?
Um, I'm not sure about that, but she did. She had reduced oral intake because she was unable to finish her meal and refused to eat. Maybe because she was afraid for what she would vomit the food.
I see. And do you notice any joint pain or any bruises or reddish at the skin?
Um. No. There were not.
Okay, I see. And may I ask, does any of the family member having the same condition like your daughter before?
Uh, Before my daughter has this fever, my son and my husband also had fever before her, and they did went to clinic and did blood investigation, and they had been diagnosed with dengue fever.
I see, I see. Right. Puan, now I will ask some questions that related to other part of your body, of your daughter's body. Firstly, does you notice that your daughter have any chest pain?
No.
Is she complaining having shortness of breath in the night? or when she was sleeping, or when she was lying?
No.
Okay. What about her cough? What is the characteristic of her cough?
She has cough chesty in nature, but her cough does not come with sputum, with phlegm.
Does it have a sputum?
No. No.
Do you notice that she have rapid breathing when she was coughing?
No.
No, okay. What about her abdomen? Do you notice she was having any diarrhea or constipation?
No.
No, okay. Is she have complained any abdominal pain?
Yes, abdominal pain.
Yeah, she complained abdominal pain.
Yes.
I have asked about I have already asked about the urine output, right?
Yes.
Um, she is she complain any neck stiffness or any or do you notice any abnormal movement of your daughter?
No.
No. Do you notice any gum bleeding or any her nose bleeding or like that?
No. No bleeding.
Let's see. Do you know? Does your daughter have a sore throat?
Yes, she had sore throat.
How about ear discharge or eye discharge?
No.
Okay, I see. Can I know is your daughter have been admitted for any medical illness before or any surgical history?
No, this is her first hospitalization.
Okay. What about her birth history? Is there any event happened when she was delivering or before or after?
No, everything was normal. Um, everything was normal. She was born at term, and her birth weight was 2.9 kg.
Okay, it's normal lah.
Yeah.
What about can I ask about her nutritional history? Uh, how long she was breastfeed?
She was exclusively breastfeed up to 7 months, then continued with formula milk, and she started weaning at 6 months old. And currently, she eats adult diet, but she is a picky eater. She does not like to eat vegetables.
Oh, they, your daughter doesn't like to eat vegetable lah. I see. Most of the children are like that. And does she have any allergy before?
No,
Any allergy to any food? No, eh?
no.
What about her growth history?
She is growing well with no growth problems. And
Her, her weight and her height?
her weight is currently 21 kg and her height is 126 cm.
I see. What about her development history? How she was at school or her academic performance?
She is an active girl and has a lot of friends. And uh, she is currently 9 years old, but she goes to standard 4. Her academic performance is also good, and she was at the second of her class.
I see. Quite a brilliant child. Your daughter have completed the immunization program, right?
Yes.
Yes. Okay. Did she take any medication? Medication?
No. She only take the paracetamol tablet, but was unable to eat because having difficulty because she keeps vomiting the tablets.
I see. Can I ask about your family history? Uh, what about? Can you tell about your family? How your husband is he a smoker or something?
No, my husband is 38 years old, has no medical illness, and he is also not a smoker. And my daughter is the first daughter of 3 siblings. Yes.
I see. So You have noted before that some of your family members have already been diagnosed as positive dengue, right? Before.
Yes.
Do you? I just asking this because out of curiosity, do you living around a dengue prone area?
Yes. My housing area is also known as the dengue endemic area, and also there was also fogging activity done in the last few days.
Uh, do you have noticed at your house? Do you have noticed any water retention, unintentional water retention such as in pot or in tires?
No.
Oh, so there were no possible of that.
Yes.
I see. Uh, what about your house? Is there complete with basic electrical and water supply?
Yes.
Yes. Do you or your family have any travel history? Eating outside or having undergo water activity before?
No.
So your daughter doesn't have any activities like that. Eh?
No.
Okay. Okay, fine. Thank you. And now I've gained some information. I already have some points about what's your condition, what might be the condition of your daughter. But we now need a physical exam more. We need to undergo physical examination to your daughter. Can I take your consent from you?
Yes.
Okay, thank you.
Okay.
Yes, thank you.
Okay, can you summarize? Usually, during our examining any patient, we have like a mini stop.
I will summarize this girl case.
Okay, after introduction and welcoming and ease the situation, you
I am not quite
also
clear.
important. The first station will be when you getting the history, you must be able to think about what may be the diagnosis or the main diagnosis and the differential diagnosis. Then with clinical examination, you are going to confirm that one. So clinical examination will confirm. And the first step, it give you the history, give you about 70 and 70 above from the truth. 20 or 25 will come from examination, and there is remaining about just 5. It will be the investigation, which is done either to diagnose or to rule out other cause. Am I clear? So this is our procedure. So Ayman, now to tell us now simple summary of your case.
Okay. In summary, Miss CA, this girl, a 9-year-old Malay girl, with no medical illness, presented with unresolved fever and lethargy for 4 days duration. It was associated with vomiting, intense headache, loss of appetite, and also have complaint about abdominal pain. And she lived at the dengue prone area, and there were already family members that who just resolved from dengue fever before, which is her brother and her father. And she also had developed dengue warning signs such as abdominal pain and tenderness at the epigastric region, persistent vomiting, lethargy, and also abnormal, and also that only. However, she was not associated with other warning signs such as mucosal bleed, fluid accumulation, liver enlargement or liver tenderness, or abdominal tenderness, or even she doesn't have any rashes at the skin. On physical examination, there was also sign of dehydration on the history, such as sunken eyes, dry lip, and also sunken eyes and dry and also dry skin.
Just let us concentrate in the history first.
Yes. So from the history,
Your clinical or your working diagnosis.
from the history, my professional diagnosis for now is she is having dengue fever.
Dengue fever.
Yes.
Can you make it more clear? What type of dengue fever?
Uh, hemorrhagic dengue fever.
I'm asking you or you are asking
Oh,
me?
for that I'm not quite sure because from what I know, hemorrhagic dengue fever will come with rashes or bleeding tendency, but this patient have no bleeding tendency or and not even no rashes. So probably she was having dengue fever at febrile phase.
Again, so now she has dengue with warning sign. This is, we are speaking now about the history. We will examine and confirm or modify. So by history, you are diagnosing now 9 years old with dengue with hemorrhagic,
Hemorrhagic dengue fever.
with what, any other diagnosis?
My other diagnosis is he may have leptospirosis.
So this is your differential diagnosis. Can
Yes.
be leptospirosis. What important point do you need to ask from the history about lepto?
If she have any contact of water activity. I want to ask about her activity before. Did she have involved in any kind of water activity before?
Okay, other
Um, leptospirosis. I will ask about
chicos.
yes.
Is it important?
I will ask about
Chicos,
is there any contact with rodents before?
yes, chicos are very important. What else? You must ask about the eyes.
For any conjunctivitis efficient?
What about abdominal pain and liver tenderness, which can accompanied by transaminites and the type of pain? So we are able. What other differential diagnosis, Ayman?
I might ask about malaria, but from her history, there is no outbreak at her area, and even her fever is persistent without any pattern. But I will include malaria in my diagnosis.
What other important point for malaria? Good, you specify a very important point, which is the trend is looks, there is no special trend and it is not from area of malaria or history of travel are very important to malaria endemic area. And the most important also is the pallor and jaundice, because malaria have distracting, so the patient may got pallor and jaundice. Okay, what else? If you have some fever and rash,
Influenza or any upper respiratory tract infection.
it is not common to get rash unless you go for the other diseases like measles and the other. So it is very important to now to think about can be common viral infection like measles, like German measles. That's why you must ask about the characteristic of the rash. It is maculopapular or it is vesicular one. Macular, we may think about measles, German measles, okay, the fifth disease, like that. But if there is vesicular rash, you will think about Atira. If the patient got vesicles, what did you suspect?
Jap. In Malay, it's demam campak.
Is it chicken pox?
Yes, chicken pox. No?
Yes, yes, you're correct. But just tell me by Malay, chicken pox is. Just teach me.
Demam campak kan?
Just write it.
Demam campak. DEMAM.
The man which is fever.
Fever campak. CAMPAK. Kan? Kurang.
If I'm not mistaken, it's something char.
Cacar Okay. Yeah, but I mean it's chicken pox.
Write it in down. Just write it down, okay, in your chat. So the most important now, even I am getting the history to ask two important things, Ayman. As year 3, I am happy that you know that you have a series of differential diagnosis, starting from dengue fever, which is the most common communicable one, but you suspected also some cases like leptospirosis, like chikungunya, which are other viruses. We are now speaking about viral with rash, like measles. So you must ask about the vaccination. Did you ask about it?
Yes, I have asked about the vaccination. And she have completed.
At that moment, yeah, if you suspect measles, you must try to insist about that vaccination related to measles or like that, okay? Also mumps like that, because we have vaccination which can be repeated, especially now they are repeated it upon entering of the school, not only during the infancy. We are giving one during entering the school and another one, okay, especially if it is a female on secondary school, just to prevent the measles and the mumps. So it is very important. The second point to ask about what is the characteristic of rash? It is just, this is very important point, okay? I will open the video hoping it will not cut it. The most important to ask about the characteristic of rash, it is maculopapular. I mean maculopapular, it is in the same level of the skin and it is red, this is macule, okay? If they are connected together, it will be black. If it starts the small one to be raised, slightly raised, it is maculopapular, okay? If it is doing like water inside, like the chicken pox, it's from its name, chicken pox, okay, it will be vesicle. Vesicle can be either chicken pox or herpes simplex or like that. So the type of rash are very important. Also the most important, is this rash fading or not? Put it in your mind. Always, if you got any skin rash, just press over it. If it disappears, it means it is just simple rash, okay? But if it didn't fade, it means that it can be berberic rash. Berbera are very dangerous, which occur either with severe infection like pneumococci, meningitis, severe sepsis, okay? Or abnormality in the platelet, like if the patient has ITP or Kawasaki, like that. So it is very important to comment about two things, about the type of rash and is it blanching or non-blanching? Is it simple rash or it is berberic one? Because berbera, you are going for complete differential diagnosis. Okay, I think your colleague will speak more details about the differential diagnosis, about the rash with fever and sometimes the rash without fever and according to the type of rash. But you missed a very important point now, Ayman. Important diagnosis. What did you miss? You miss the one which make you sit at home.
COVID-19.
Yes. Yes, Ivan. We mustn't miss that. Any patient presented by fever, even with rash, because COVID-19 sometimes are presented also by hemorrhage, okay, and the DIC. So it is very important, okay, to rule out in any patient he has COVID or not. even today, if you are going just to do simple surgical procedure, you must do COVID even asymptomatic. So suppose if someone has fever and rash, it may be put it in our mind, okay? Even before admission to the hospital now, you need to do COVID. So don't forget, please. I know that dengue is the most popular common cause of fever, but don't miss the pandemic and the common. The lesson. So this is the most important point. When I meet my patient or my patient role player, who I will ask about them. Go deep for the history, ask for anything, but processing your mind to set broader differential diagnosis. So you need to ask, what about recreational activity? What about exposure to rats? What about his eye? He got any redness on it or not? What about traveling? Ayman didn't touch it. Is traveling to a red area. Any one of the family member has fever or cough or even COVID-19. Okay, you must be very clear. Okay. What about the recreational activity? What about is attending any school at the time or not? So you must try to go deep to rule out. Every diagnosis needs a few points to be asked. If you forgot, you still are not able. Okay. Am I clear? So let us see now the clinical findings by your colleague.
Okay, Assalamualaikum. My name is Nur Sutriana, and now I will discuss a little bit about dengue. So, what is dengue? Dengue is a mosquito-borne viral disease, and dengue virus is transmitted through the bite of infected female mosquitoes of many species of Aedes aegypti. And this dengue is caused by a virus of the Flaviviridae family, and there are 4 serotypes of the virus that cause dengue, which are the DENV1, DENV2, DENV3, and DENV4. And for this reason, a person can be infected with a dengue virus as many as 4 times in their lifetime. Next slide. Okay, so as I mentioned before, the transmission of dengue viruses are through the bites of infected Aedes species mosquito, which act as a vector because they need blood meal for egg production. So this mosquito typically lay eggs near standing water in containers that hold water, like buckets, bowls, animal dishes, flower pots, and vases to breed. And this mosquito prefer to bite people and live in both and can live both indoors and outdoors near people. And this mosquito become infected when they bite a person infected with the virus. Then the infected mosquito can then spread the virus to other people through bites. Next slide. Symptomatic dengue virus infection most commonly present as mild to moderate.
Sorry, Sofiana.
Yes.
Just remember, subhanAllah, this mosquito are always hungry. So if she bite someone and found another one, she will go to bite him, but she has full stomach. So she will regurgitate the blood from the first one and got another one. You see how they are doing, because don't underestimate the insect bite, okay? So if she came to the next one, so she will also put her antenna and prick him, and then she has full stomach. So she will give him the blood from the previous one, who is dengue or whatever, malaria or whatever, and got new sample and go for the next one. That's why we must always pray in the morning and afternoon, like azkar. We don't know, even something you are noticed, like insect bite, like whatever viral, it may be Allah will protect us. if we say بسم الله الذي لا يضر مع اسمه شيء في الأرض ولا في السماء in the morning and afternoon. Okay, good. Continue.
Symptomatic dengue virus infection most commonly presents as a mild to moderate, non-specific acute febrile illness, and approximately in 1 in 20 patients with dengue virus disease progress to develop severe life-threatening disease called severe dengue. And dengue viral illness can be classified into two, dengue and severe dengue. And dengue is defined by combination of two or more clinical findings in a febrile person who travel to or live in a dengue endemic area. Next slide. Okay, the clinical findings include nausea, vomiting, rash, ache and pains, a positive tourniquet test, leukopenia, and also following warning signs. Okay, so severe dengue. Okay. Next, severe dengue is defined by dengue with any of the following symptoms: severe plasma leakage leading to shock or fluid accumulation with respiratory distress, severe bleeding, or severe organ impairment. Okay, next slide. Okay, dengue begins abruptly after a typical incubation period of 5 to 7 days, and dengue present with three phases, which are the febrile phases, critical phases, and recovery phases. Okay, febrile phases is characterized by sudden onset of high fever, which will last 2 to 7 days, and also accompanied by other signs and symptoms such as severe headache, retroorbital eye pain, muscle, joint, and bone pain. Early blood findings show low total white count followed by decrease in platelet. And also serology shows high of viral load during this phase. And this phase usually lasted without any complication. Next phase is the critical phase, which is characterized by a rapid drop in temperature and increased vascular permeability, which can lead to plasma leakage. And this phase often occurs either at late febrile phase or before defervescence, which is a drop in the body temperature. And this phase typically lasts for 24 to 48 hours. And most patients clinically improve during this phase, but those with plasma leakage can develop severe dengue. And during this phase also, patient may develop shock, altered conscious level, and accumulation of fluid. And this shock can also lead to other organ impairment. The laboratory changes in critical phase show increase in hematocrit, followed by thrombocytopenia. And the IgM and IgG also start to increase. And the last phase is the recovery phase, which takes place 24 to 48 hours after the critical phase. And during this phase, usually plasma leakage stops and followed by reabsorption of extravascular fluid. And the patient's well-being also start to improve, and some will present with classical rash, which is called white island in sea of red. Next slide. This is the picture of the white island in the sea of red. Also, in this recovery phase, the platelet count will return to normal and followed by the white cell count. We also return to normal. That's all. Next is the complication.
Okay, continue. Okay, continue. What happens?
I think he muted her mic.
Doctor, I think she has problem with her mic.
Okay, you can continue presentation, and he can and you just turn the slide for you.
Hello?
Yeah, yes, Maria, dengar.
Okay. For complication, yeah, as Nur Sufiana said, in febrile phase, it rarely develop complication, but if there is, it will be dehydration and also febrile seizure. So in our patient, there is sign of dehydration, which is mild dehydration, because she appear lethargic and also dry eyes and dry lips and mouth, and also the eyes are slightly sunken. And also the urine output also decrease. Febrile seizure is not present in our patient, but signs of febrile seizure can be the face may turn blue or red, the eye rolling upwards, the loss of consciousness, and also abnormal movements of muscles and limbs. And the fatal complication is the severe dengue. Uh, the hallmark of severe dengue is the plasma leakage. Uh, and the severe plasma leakage will lead to shock or fluid accumulation like pleural effusion and ascites with respiratory distress. It can also present with severe bleeding and also organ involvement like liver, CNS, and heart and other organs. For the investigation, there are 4 investigations that is being done in this patient, which are for blood count, ELISA or rapid test for detection of the antigen and antibody of the dengue virus, liver function test, and also BIOS. For full blood count, we did it to detect any sign of infection or anemia. So the comment is the patient is not anemic, but the hematocrit is slightly high, which may indicate a sign of dehydration. Yeah, and the patient also present with leukopenia and thrombocytopenia, which are in accordance to the laboratory findings of dengue fever in febrile phase, and also the patient also have lymphocytosis, which may indicate a viral infection. For detection of the antigen or antibody of the dengue virus, we do ELISA or rapid test. For in this patient, the NS1 antigen is positive, so it means the patient is positive dengue, but the IgG and the IgM is not done. For liver function test, we do to detect
Come back, please.
the
Come back, please, for the previous slide.
this one.
When is the best time to choose between NS1 and IgG and IgM?
If the patient present with 1 day or 2 day of fever, then we do NS1 antigen. If 3 to 5 days onwards, we can do IgM. Yeah.
Usually IgM would be from the 5th day, like that. Okay. So early. Now we have also combo in the KK. It is available. It can be done, but we prefer to be more specific. Okay.
Okay.
Good. Continue.
Okay. For liver function test is to detect the liver function, or to know if the dengue has impaired the liver function. So in this patient, the liver is normal. If it is affected, the AST and ALT will rise in BIOS. Also normal, but the creatinine is slightly low, which might also indicate dehydration. For the management of a patient with dengue is according to the clinical phase that is presented. So when the first encounter of the patient, we should establish whether the patient has dengue or not, and to determine the phase of the illness, and to recognize if there is warning signs or presence of severe dengue. Not all patients will need hospitalization, but indication for hospitalizations are presence of warning signs, infants, children with comorbid factors, and also social factors like living far from health facilities and also transport issues. For dengue fever without warning signs, it can be managed without hospitalization, but we need to educate the caregiver about the fever control, the to avoid the NSAIDs, and also the course of illness. We should give the home care card, which is at the right one, which tell the patient what should be done, what should be avoided, and uh, what and what are the warning signs for danger to take the patient into the hospital. However, dengue fever without warning signs will need to come to hospital daily for clinical or laboratory assessment. And while dengue fever with warning signs in this patient, the management plans are to give the IV drip of normal saline, to repeat the full blood count, renal profile, and renal profile for monitoring if there is any complication, and also the hematocrit to monitor the dehydration. Also prescribed syrup paracetamol and ranitidine to prevent heartburn, to encourage oral intake, to chart the input and output, and also to monitor the blood pressure. For severe dengue, there are many severe dengue can present with many types, like severe dengue with compensated shock, with hypertension, or with recovery shock. So, but in all severe dengue, there are three major priorities, which are replacement of plasma losses, early recognition and treatment of hemorrhage, and also prevention of fluid overload. For fluid therapy, there are two types of fluid therapy, which are uh, initial and rapid fluid bolus to reverse the shock, and also to titrate the fluid volumes to match the ongoing losses. However, for a patient with warning signs of plasma leakage but is not yet in shock, so the initial fluid bolus may not be necessary. The fluids in dengue must be managed in a way that is only given when it is needed, and not given when the patient enter the recovery phase, to avoid the fluid overload. The hematocrit will be the guide for IV fluid therapy, and not the other way around. That's all for management.
Okay. So we realize now the most important is the clinical monitoring and judicious use of fluids. Okay. And you must define where you are going to send the patient. If the patient is just simple dengue or dengue with warning sign, it is different level of care. If patient we have dengue, severe dengue or complicated one, so you may consider referral to more high dependency or ICU case. Okay. Okay. Continue. You still about have 7 minutes. Try to finish on it, inshallah, so we can go for the second case. Differential diagnosis.
Yes, Assalamualaikum. Now we go to the provisional and differential diagnosis. Next. Okay, so for the provisional diagnosis, this patient is having dengue fever at febrile phase. where the patient had fever and also some warning signs, which are lethargy, abdominal pain, and persistent vomiting. And the patient also had intense headache, living in endemic area, and family members had dengue before. And as for the points against, the patient came with no rash, no bleeding tendency, no hepatomegaly, no myalgia or arthralgia. Next. So as for differential diagnosis, the first is leptospirosis. The points for fever of sudden onset, headache, nausea, fatigue, chills, and rigors. And but the patient had no water activity, no rash, no myalgia, and no diarrhea. And second is influenza, where the patient had fever and chills, headache, cough, sore throat, fatigue, and vomiting, but no runny nose, no rhinorrhea, and no myalgia. And another differential diagnosis is malaria, where the patient had fever and chills, headache, nausea, and fatigue, but no outbreak at the area and no travel history to endemic area, and the fever is persistent without pattern. Next. And another is chikungunya, where the patient had fever, headache, nausea, and fatigue, but no outbreak at the area, no travel to endemic area, no myalgia or arthralgia, and no joint swelling and rash. And next is adenovirus. So the points for fever and chills, sore throat, vomiting, stomach pain, and nausea, but patient had no runny nose. And another differential diagnosis is infectious mononucleosis, which is caused by Epstein-Barr virus, and the patient had fever, sore throat, headaches, and extreme fatigue, but no rash, and also no history of blood transfusion or organ transplant. Next. Next is measles. So the patient had fever and cough, but no runny nose, no rash, and he also completed the immunization. And lastly is COVID-19. So the patient had fever or chills, cough, fatigue, headache, sore throat, nausea and vomiting, but no history of contact with COVID-19 patient, no shortness of breath, no myalgia, no loss of taste or smell, and no runny nose and diarrhea. And I think that's all for the differential diagnosis.
We can add also negative RTK or negative PCR test for the COVID. So our mind, good. You did it just we discuss with your colleague, or you did it before this slide? Umaira?
Yes, I did it, and I referred
Umaira,
to yes,
can you hear me?
yes.
Yes, it is a good slide. Yeah, just the test of the COVID are negative. Okay.
Okay, okay. Thank you, Doctor.
Okay. Thank you. It is a good. Okay. Let's go for the OSCE.
Assalamualaikum warahmatullahi wabarakatuh. I will present the OSCE. And the first one is a man OSCE. A child is presented with fever, myalgia, and vomiting for 2 days. And S1 and IgM for dengue are positive. The count is 60 times 10 to the power of 3 per liter. Per liter, right? And the question is, you are the housemate on duty at emergency department. Counsel the parents regarding the diagnosis. So for this station, it's basically a main station. So to answering this question, we need to do a role play. So I will become but doctor, do we have more time to do a role play for this question for the station, or we will move to the next station? Okay. for this session, I will become the parents, and one of you will volunteer to become the doctor to counsel me, which is the parents. So who want to volunteer? Can I invite uh, uh, how about Brother Akmal? Do you want to volunteer? Become the doctor to try to counsel the parent?
I'm okay, but I just want to ask because when I see this question, there is something that lingering in my mind. What
Yes.
should I counsel to the parents? What I mean, we know that the diagnosis already. We know that it is a dengue, and then apart from that, what else should we tell the parent with regards to?
The first one is the result of the investigation.
Okay.
What is the result of the blood test? And the second one, what is our diagnosis and why? But and then the next one, we must the parent may ask about the management and how we want to treat and what is the next step. Is admitted, is this patient will be admitted to the ward or can be returned home, or what is the medication, or such as I believe that Maria explained before, right? The management. And then the last one is the parent might ask about about the dengue itself in general, because the nature of a parent.
Okay. Okay. So I try. Okay. If I'm wrong, please correct me.
Correct.
Okay. Bismillahirrahmanirrahim. Assalamualaikum. Wait. Aiman, so you are being the parents, right?
I am now the father. The father of.
Oh, you are the
this
father.
girl.
Okay.
Yes.
Mr. Aiman. Okay. Bismillahirrahmanirrahim. Assalamualaikum, Mr. Aiman.
Waalaikumsalam, doctor.
How are you today?
I am fine, but my daughter, how is she?
It is how to say this? How to put it together? Okay, like this. We have performed a few investigation on your daughter. We've taken her blood. Okay, and the result from the investigation shows that this patient is having this patient from the blood test itself. It shows that this patient, your daughter, is having quite low platelet count, and there is presence. What?
Continue.
Okay, there is presence of NS1 and IgM antibody. Okay, that is indicative of dengue. Okay, in your daughter. So what I can say about your daughter is, for the time being, your daughter is having dengue fever. Okay, it is quite unfortunate to tell you. However, Alhamdulillah, you came early. Okay, so we are able to manage this in a proper manner, a more proper manner. Okay, because it is still in the early stage. Okay, okay. So for the management that we are trying.
Wait, doctor. Is my daughter condition is not serious, right?
It is not serious yet because it is quite early. But if we don't intervene early, it might become serious.
Oh, I see.
So gladly you come early.
I want to ask, why? Never mind. I want to ask, is my daughter need to be admitted to the ward?
Unfortunately, yes, because we need to monitor the treatment. Okay, the responsiveness to the treatment of your daughter, so that we know what we need to do next. Okay, and inshallah, the condition, if we manage it properly, your daughter's condition will improve gradually, day by day.
How long approximately she will be in the ward?
Maybe 3 days, maybe 5 days.
I see. Can someone accompany her in the ward?
Okay, out of topic. I don't know.
Okay, I see. So what the next step should we do for my daughter?
So Yeah. Okay, so she will be admitted first, okay, and then we will monitor. We will infuse her with a saline because it is because we want to prevent your daughter from developing shock, okay, because we know that because in dengue we have 3 stages: the febrile stage, the critical stage, and lastly the recovery stage. And what is most important is we need to prevent that critical stage from becoming bad. So we need to infuse her with normal saline, okay, to monitor her fluid, okay.
I see. Right. So when she will be discharged, will she have any medication that she will take?
Pardon? Sorry, my internet suddenly become.
When the time that she will be discharged from the ward,
Okay.
and can be taken home, is there any medication that she will take?
Medication, how to put this? I'm not sure. I'm sorry.
Thank you, doctor, for treating my daughter. Thank you, doctor. Okay, that's all for station 1. So you can have overview on what probably the
Just
hospitals did.
important reminder for you. Thank you for this station or this slide. But always you must have a good introduction. And you must ask the patient what he knows about dengue fever. He may experience dengue before because people in Malaysia are keen to know, and most of them are knowledgeable. So you must ask him, what do you know about the dengue? Is there any member of the family before got it? Like that, you may find him have a lot of knowledge. You are not in need to mention, just to confirm. Okay, and one, try to introduct and sympathize with the patient. Number 2, try to ask what is the patient knows. You just need to confirm and to continue from that point. And the most important point, because we are working with human being, and you may not be able to understand the feeling of the patient unless you are in his situation, and Allah put you in the other side, which you are healthy and he is unhealthy, or his kids are unhealthy, which is more traumatic to any father or mother. So you must be sympathized. Try to put a good news beside the bad news. If you are going to tell whatever bad news, your patient, your kids has dengue, your kids has lymphoma, your kids has leukemia, your kids has whatever, any problem. This is our job. So must put it, but she's stable at the time, like that. In our patient, he is stable on the time, but we are afraid because the platelet are low. We need to monitor it. We need to repeat it, because if it is more low, we are afraid it can start to bleed, and your child has a warning sign like vomiting and thrombocytopenia, and we must take care about that. Our role is to monitoring and try to help. Sometimes details about we are going to give him bolus of normal saline, we are going to challenge her fluid and give her as required, like that. Okay, just but it is a good point from you, but just concentrate on that one. Good sympathize introduction. You are dealing with human, whatever he is, and you understand that role is changing. A patient with a doctor, and he will comment, oh, why is the doctor go directly? He think I am not a human, just to shock me by a diagnosis and continue speaking. You must understand that if you tell him your daughter has severe dengue or dengue with warning sign, he may get some drowsiness, and he's thinking about his daughter, and about the admission to the hospital, who will sit with her, and what about the cost, and what about 100 of things. So please sympathize, introduce yourself, sympathize with the patient, ask the patient what he knows, and try to put الحسنة beside السيئة. أتبع السيئة الحسنة تمحوها. The hadith, good thing with beside a bad thing, so the patient may feel happy. Really, if you start your life by that, you will be a very good professional. I attend many times. If you just make this maneuver, your child has ALL, but hopefully we have now a very strong hemato-oncology in Malaysia who can manage, and they are good, a very good result. It is more than 95% improvement, which is better than COVID and the other virus. But we need to restrict to the treatment, to be patient for the time like that, okay? So counseling of the patient are very good. Okay, hurry to see the remaining because your time already done about minutes ago. Continue of the next slide are okay. We can omit and your colleague can see it. Can I see the next slides?
And the next slide. So session 2, this one OSCE sample of OSCE question of unmanned OSCE. The boy was presented with liver, headache, and rashes. The first question, according to this picture, describe the rashes. Who want to answer? I think this has been explained by Sufiana and Tira and Maria before, right? So, who want to answer?
I want to answer.
Okay, please answer.
White islands on Sea of Red.
Yes, you are correct. Yes, you are correct. The second question, what is your diagnosis? And which phase of this disease did the rash start to appear? Umaira, do you want to answer?
Dengue fever, and the rash appear during recovery phase.
Okay, right. You are correct. And the last question is, give 2 complications according to your diagnosis. Sufiana. 2 complication of dengue, right? Our diagnosis tadi. So there's a lot of complication.
Dehydration and shock, hypovolemic shock.
Right, you are correct. Next. Okay, next. So that's all from me. 2 station of OSCE, 1 man and 1 unmanned. So thank you.
Okay. So now please readjust your mind how to think about the fever, which is the most common symptoms in pediatrics. Okay. And you must be able to get a deep history, then clinical examination, then investigation, and you must be able to define what is the direction. And if we have fever and rash, it is another differential diagnosis. If you have prolonged fever, which means pyrexia, prolonged fever, or pyrexia of undetermined origin, which means more than 8 days in the hospital, or 21 days or shorter if in outpatient like that, you must also ask yourself what can be the fever which we cannot conclude the cause. So fever are very important, please. You should have in your references like that. New Nelson, which it is not so new, it is 2 years ago, speaking about symptoms-based diagnosis, Nelson book. It is very nice, but it go deep really. You may just pick superficial, or you can go for the up-to-date for fever in children, you will find everything is clear. Okay, the main points. That's good. Do you need to ask any question? Okay, then we can go for the second case. Good, Ayman. I will give you 7.5 today. This is your marks. Okay, Ayman.
Yes, thank you, Doctor.
Just record it, please. Don't to be missed after that. And the next time, inshallah, try to get the point which I guide you for it. Okay. Okay. Who will be the second doctor today? And thanks for your team. They did a good job. In despite I was suspected Oski to be more deep. I mean to speak about the bleeding tendency and the tourniquet test and the other are very important. Okay. Can be added to the presentation. Okay, go ahead. Is it Umaira?
It's me, Atira, Nur Atira.
Kathira, okay.
Oh, wait a minute. Okay, so Assalamualaikum warahmatullahi wabarakatuh. For the second case, it will be presented by me, Atira, Suhaib, Bakis, and also Akmal. So for Roti, I'll be the doctor, and the patient mother will Suhaib will be the patient's mother. So can I start?
Okay.
Assalamualaikum, madam. I am Atira, a third year medical student. May I ask you a few questions regarding your child?
Sure.
Okay, so can I know what is your child name and age?
Her name is SNA, and she's 8 years old, Malay, and she's Malay.
So what brings you and your child here today?
So she has, her face is unusually puffy, and she also her abdomen was a bit enlarged for 2 days.
For 2 days. Can you please explain to me what actually happened to your child before you came here?
So before I came here, her face become suddenly puffy. So I thought it was just a normal morning puffiness, but and then her eyes. But then when I look at her eyes is also swelling. So there's some swelling around her eyes, and also her her belly was a bit distended, a bit enlarged.
Okay. Is the abdominal distension is associated with constipation?
Yes, there is constipation.
And if is there also abdominal pain or nausea and vomiting?
No, she never complained for any abdominal pain or nausea or vomiting.
Did she previously vomit blood or passing out a red stool?
No, she also never complained of those symptoms as well.
Did she experience fever?
Yes, there was fever, but it wasn't that long. It's only for 1 day.
Okay. Is the fever associated with other symptoms?
There was she also had eye tearing and also redness. Her eyes were red and she had runny nose.
Okay. Is there anything you do to help her to reduce her fever?
Yes. So she took a bath, and then after that bath, the fever was relieved.
Okay. So when there is fever, did you take the temperature of your child?
No, I wasn't able to.
Did she also took any medication like paracetamol?
No, she did not take any medication.
Okay, I see. And did she also has any had any skin lesion?
Yes, I noticed some skin lesion on both sides of her leg, and it's been for quite a while now, for a month.
Okay, so did you ever meet other doctor previously to help treat the skin lesion?
No, I did not. I did not meet other doctors. I just put some ointment on over the lesion.
Okay, when she urinate, did she complain any pain? Any pain?
Yes, she did complain, pain when she was urinating.
So did you observe if she had any reduction in urine output, and what is the color of her urine?
Yeah, I noticed that she was urinating quite low. I mean, less urinating, and the color is dark, almost as tea colored.
Okay, so does this reduction in urine and tea-colored urine associated with urine incontinence, or did she also experience frothy urine or increase in frequency or urgency?
She did not, and there was not any, like you mentioned, there's no frothy urine, but there was urinary incontinence.
Oh, okay. So before you came here, did you send her to klinik kesihatan before, or have you meet other doctor before this?
Only today, I went to K Jaya Gading. Yeah, only today.
Okay. So okay, so now I'll ask you a few questions regarding other system. So does she had any chest pain, palpitation, or shortness of breath?
No, she did not complain any of those symptoms.
Did she complain on runny nose, or if she have cough, noisy breathing?
Yes, she did have she did have runny nose, and but there was no she never no complaint of cough. I didn't notice any cough or any shortness of breath.
Right. Did she previously had a loss of consciousness, headache, blurring vision, or seizure?
No, she did not have any of those symptoms.
Okay, so did she also complain of muscle pain, joint pain, bone pain, or if she experienced any fracture before this?
There was no such complaint of those symptoms as well.
Okay, so when you look at your child's skin, is there any yellowish discoloration, or did she also complain of itchiness, and if you see that her stool is pale?
No, she didn't. She does not look yellow. She looks normal, and no, there was no itchiness on her skin.
Okay. So did she also have pallor or any bruises on her body, or gum bleeding and nose bleeding?
I did not notice any of any bruises on her body, and also there was I didn't notice any gum bleeding or nose bleeding.
Okay, so beside the skin lesion that you had mentioned, did you notice any ulcer or rashes around her body?
No ulcers or any rashes, only just the rashes.
Okay, only the skin lesion you had mentioned before, right? Okay, so did she had any other medical illnesses?
No, she did not have any other medical illness. I think this is her first time.
Okay, so did she has any surgery done before this?
She also did not have any surgery before this.
Okay, can you explain me a bit about her birth history?
So she was born in HDA on 28th of October 2011. Her weight was 3.8 kilogram, and she was delivered by through a cesarean section. Uh, Yeah.
Okay. So while during pregnancy, did you had any problem?
Yes. Well, during the pregnancy, the doctor diagnosed me with to have a gestational diabetes.
Okay. So when she was delivered, after she was delivered, did she has any problem?
She did have a problem. The doctor mentioned that she had jaundice for 1 week. Yeah, for 1 week only.
Okay. Can you tell me about her diet? Like what she eat for breakfast, lunch, and dinner?
So she has her diet is she eats 3 times a meal per day. So her breakfast usually consists of hand feed of rice with some chickens. Her lunch is also hand feeds of rice and chicken, and her dinner is also hand feed of rice and chicken. But she did not eat any fish or vegetable because she is a picky eater. She only eats chicken, and she do snack sometime with biscuits.
Okay. So when did she start her first weaning?
She started weaning at 6 months old.
And what was she given with when she was delivered? When her did she was given with
Yeah,
formula
she
milk
was
or breast milk?
she was given formula. She was giving formula milk because I wasn't able to produce the breast milk.
Okay. So can you tell me about her when she was at school?
Okay. She is currently in standard 2 at SK Jaya Gading, and she attends a special education class because she's a bit slow in learning since last October. And normally she can normally socialize with her friend only, and then she also has an OQ card because of her learning ability.
Okay. When did your child meet the development milestone?
So she was able to walk without support at 1 years old. She can speak full sentences by the age of 2, and she was starting to toilet training at 2 years old and 6 months.
Okay. So did she completed her immunization?
Yes, she has completed her immunization so far.
Okay. Uh, did she took any medication before this?
No, she did not have any. She did not take any medication.
Did she had any known allergy?
Uh, she has an allergy towards seafood.
Okay. So can you tell me a bit about your family?
Okay, so she is the youngest daughter in the family out of five, out of five. So and then her other sibling is also is well and is still alive. So and then I'm 48 years old, and that is already divorced with her biological father, and then remarried to another husband, another man, and now we are living with the with the with her stepfather.
Okay. So who she lives with and where?
She lives with the family members at Kampung Sri Damai. At Kampung Sri Damai, yes.
Oh, okay. So where is the nearest KK klinik kesihatan from? How far is the klinik kesihatan from your house?
If I'm not mistaken, the closest clinic is around 1 kilometer away from the house.
May I know your household income?
My household income is 1,000 ringgit per month.
Okay. So in your household, is there anyone who smokes?
There are some smokers. Her brothers do smoke. Some of the
Okay.
brothers.
So where she usually play?
She usually play in the sand near that is in the surrounding area of the house.
Okay, thank you, madam. That's all from now. Now I will perform some physical examination to look at your child condition. Thank you.
Okay. Can you summarize the history for us?
Okay, my patient, SNA, 8-year-old Malay girl, she came with facial puffiness and worsening of abdominal distension for 2 days. And it also associated with periorbital, she also presented with periorbital edema. And she also had fever for not more than 1 day and had a multiple skin lesion over the bilateral lower limb for 1 month duration. She also experienced dysuria, oliguria, and also hematuria. There's also urinary incontinence. Besides that, she also presented with a history of coryza, and she also has a learning disabilities. That's all.
Okay, so what is the title of your case?
The title is a post-streptococcal glomerulonephritis.
Not the diagnosis.
Oh,
The title
sorry?
is puffiness and
Oh, okay. Facial puffiness and abdominal distension.
puffiness, abdominal distension. She has skin lesion or not? The skin lesion is still active?
So when we perform physical examination later, when there is only scar.
Okay, good. So a non-patient of learning disability
Yes.
presented by puffiness, distended abdomen with a history of skin lesion 2 weeks ago. Yes?
Yes.
If you summarize the knowledge,
2 days
you
ago.
will come to the conclusion.
Yes.
Okay, so what's your working diagnosis now?
So first diagnosis, provisional diagnosis is post-streptococcal glomerulonephritis because she presented with first edema. There's present edema. It is proven by the facial puffiness. There's also abdominal distension and also periorbital edema. And beside that, she also had tea-colored urine, which may indicate gross hematuria. And she also had a history of impetigo, skin lesion.
Okay. What is the differential diagnosis? Athera, did you suspect?
Other different diagnosis is nephrotic syndrome because she had edema on her face, facial swelling, and also had facial edema, and also she had periorbital edema and also oliguria. But she mentioned that there is no frothy urine.
Okay, more differential diagnosis.
Other differential diagnosis is urinary tract infection because she presented with dysuria and also fever. But once again, she did not have any increase in frequency or urgency. That's why I put it into differential diagnosis.
More differential diagnosis.
Other is IgA nephropathy because she had a skin lesion. We need to check if the skin lesion is actually impetigo or it can be henox-snow-lane purpura, which can present with IgA nephropathy. Yeah.
So good. You are memorizing a major causes, but if you are going to start our clinical life as systematized as we can, you will pick important point. If patient came with puffiness of his eyes, okay, so we are going to ask ourselves, is it limited or generalized? I mean, limited to the eye, or we have now another, like you needed to ask about is there any genital edema or not, okay? You must ask about the leg edema, even about the respiratory, because if the patient got also pleural effusion, may got respiratory distress. So we must ask, is it atopical, maybe infection or allergy to the eyes, or it is a part of systemic disease? Okay, and if we come to the conclusion that it is edema, so we must ask Athira again, what can be the cause of generalized edema? You told me.
You mean like hypoalbuminemia? Oh, nephritic can also. Sorry?
Okay. What else?
Nephritic can also present with
edema.
Edema, yes.
What other organs can be causing edema?
What other organ can causing edema?
So hi, what did you suspect? Is only the kidney?
No.
Can the lung also have edema?
What other? Umaira.
Heart.
Yes, heart failure can cause edema. What other organ other than heart?
Liver.
Liver. Yes, liver failure and liver affection can cause edema. What other? Do you hear about a common case which is kwashiorkor?
Yeah.
Protein deficiency, malnutrition. What will happen? You will find the child in spite, you will find him edematous, and you may find his albumin also low due to the same cause. So maybe malnutrition, and also can be autoimmune diseases. Some of them can cause like that. So even if we start by edema, we must know what can be differential diagnosis. And then we found symptoms related to the urine. So we most probably are going to think about the kidney, but the urine looks tea-colored or cola-colored. Yes? So why it is cola-colored, and what is the difference between that cola-colored and fresh blood?
There is presence of blood.
No, I mean, if you see the urine with red color or tea color, what is the difference? It's very important, okay? Usually if the blood comes from glomeruli, it will be distracted and come to us, okay? This cola or tea color, okay? If it came from down or from other causes like severe infection or malignancy or stones, it can come with fresh blood. So if you found the urine is cola colored or tea color, you must suspect glomerulonephritis. One of them known as post-infectious glomerulonephritis. Post-infection. The most common cause are streptococcal, but it may be other causes, other infection, okay? The one is most common here in Malaysia is the post-streptococcal glomerulonephritis, but you can find, but it also can be other causes of glomerulonephritis, either IgE or a part of systemic disease like SLE, okay? So it is very important to arrange your mind how you are thinking by a manner so you will not miss anything, okay? So now we have an important clue: impetigo and skin lesion, and then after some time, the child start to get tea colored, okay, and edema. So it looks like post-infection or post-streptococcal glomerulonephritis. What is the important clinical sign do you need to look for, Athira?
Yes, clinical sign in post-streptococcal glomerulonephritis is firstly, obviously, it's the edema, hematuria, if the patient have hypertension,
Yeah,
and
this is
also
this is the most important. You must run and measure the blood pressure. Okay, because most of these patients, due to fluid accumulation, may get severe hypertension, and some of this can even come with encephalitis, hypertensive encephalitis. Okay, so don't forget the blood pressure. Okay, to determine. Usually, nephrotic can come with shock, we can come with normal blood pressure, but if you start to find also high blood pressure, we may consider is it nephritic or nephrotic or mixed. Okay, this is very important. So now we understand the importance of the impetigo and the skin lesion, which can cause glomerulonephritis, and we know what is the difference between the color of the urine and its importance. Okay. Yes. Now, Athira, what is the investigation you are going to consider for this patient?
so in this patient, I would like to do first check the anti-streptolysin O to measure to check if she had previous streptococcus infection. And second one is because she had edema, it's important to do urinalysis to check for if she had actually hematuria or if there are any proteinuria as well. And pyuria can also presence.
What other findings in the urine?
Other finding is red blood cell class.
This is the pathognomonic one, red
Right.
cell cast. It's very important, okay?
Yes.
So now you ask it for ASOD. We just need to remember that there is anti-DNAs for streptococci. It is available a bit expensive, but it is more specific. Anti-DNAs for streptococcal infection. You comment for the urine, and this is an important lesson. If I am going to get any investigation, I try to go deep. This urine can give me a lot of knowledge, okay, about the amount of urine is the patient is olivoric or non-olivoric. What about the color of the urine? Is it concentrated or no? So I need to see the specific gravity. I need to comment about the color. Then I need to comment about, as you speak, about hematuria. Is there any UTI or not? Is there any protein or not? Okay, and the casts, which is very important. In glomerulonephritis, we found RBC's cast. Okay, in nephrotic, sometimes you can find the hyaline cast. Okay, you must know for everything the specific. What other test do you need to do, Athira?
Besides that, we can also do liver profile, especially to check for the albumin. If she had proteinuria, then she can present with hypoalbuminemia. And we can do complement levels too, because this is there is infection before, so usually complement level reduced in this patient.
Which one decreased?
C3.
Hmm?
C3.
C3, which is the most, yes. That is the most important, the C3, but C4 is normal.
What?
Okay,
Sorry?
and we may need to consider C3 is decreased by C4 are normal.
Yes.
This is an important one. Okay. Any other investigations? Which is
Full blood count. Let's check for full blood count to see if there is increase in white blood cells. And renal function test.
Yes, you cannot judge the renal patient without getting the kidney function test. It is very important, okay? Don't forget it. Any organ you are dealing with, you must remember to check its function. So renal function, if there is renal impairment or not, is a very, very vital and important one. Okay? Good. So let's go for your slides. Continue now.
Okay, so I'll start with the general examination. So during general inspection, she appeared pink, alert, and normal with normal activity and movement. She is comfortable and well. She's lying on supine position and not in respiratory distress. There is a granula attached at the right dorsum with no active infusion. For examination of the hand, it is normal. It is normal and BCG scar was noted on the left shoulder. There is no pallor of conjunctiva and scleral jaundice. There was no central cyanosis and her oral hygiene and hydration status was good. There's no increase in jugular venous pressure, no pedal edema, and during a lymph node examination, we found out there is multiple lymph node that is palpable over the right submandibular area with size about 1 centimeter times 1 centimeter, which were firm, non-tender, and no skin changes. There is also bilateral inguinal lymph node palpable. It is tender and however, the size could not be appreciated because the chart cannot tolerate. On skin examination, multiple impetigo scar was found over the bilateral lower limbs up to the knee with new lesion over the right shin and knee with left cuff with largest size about 2 cm times 3 cm. So for vital sign, the blood pressure is 137 over 84 millimeter mercury, which indicate hypertension. And she is, her heart rate is 120 beats per minute, regular rhythm and good volume. Respiratory rate, 22 breath per minute. Temperature, 37 degrees Celsius. And her partial pressure of oxygen is 99% under room air. So anthropometric measurement, her height is 119.4 centimeter. Weight, 21.1 kilogram. BSA 0.84 meter square, and her body mass index is 20.76. For your information, she is located at the 10th centile. So for abdominal examination, the abdomen was mildly distended and moved with respiration. The umbilicus was central and inverted. There is no dilated vein, and her female genitalia was not edematous. On palpation, her abdomen was soft. However, there was tenderness over the right iliac region. The liver and spleen were not palpable. The kidneys were not ballotable. On auscultation, the bowel sound were heard. And for cardiovascular examination, on inspection of the precordium, there is no precordial bulge, dilated veins, or surgical scar seen. The apex beat was felt at the left fourth intercostal space at left mid-clavicular line. There were no trills detected, and there was left parasternal heave noted. And on auscultation, there was dual heart sound with no murmur or added sound. on neurological examination. On central nervous system examination, she had normal mental status and alertness. There is no neck stiffness. Anterior fontana was closed. The cranial nerve were grossly intact. And on peripheral nervous system examination, muscle tone, power were all normal on all limbs. The tender reflexes were normal and equal bilaterally. Sensation, coordination, and proprioception were intact on all limbs. On musculoskeletal examination, the joints were not swollen and not tender, and the spine was normal. So in summary, SNA, an 8-year-old Malay girl with underlying learning disability, presented with facial puffiness and abdominal distension for 2 days. She also experienced fever, dysuria, oliguria, hematuria, and incontinence. There is no frothy urine or pedal edema, and on examination, there was cervical and inguinal lymphadenopathy, mild abdominal distension, and tenderness over the right iliac region. So this is the provisional diagnosis.
Just to come back, all these important slides which you presented before are very important. We are not doing it because of the presentation. Our examination must go through this for every patient, general, and then you come to the system, which is the main system you need to examine. Then you are going to examine the other systems to rule out either another signs you are searching for, or if there is complication of the disease. Okay, this is a very, very important one. Okay, come back to the last slide. Okay, okay, continue.
Okay, so for
Okay.
yes, for provisional diagnosis, sorry, doctor.
To ask about lymphadenopathy, I can know that lymphadenopathy is in the inguinal due to infection, but why it is there in the cervical? Did you examine the tonsil?
Yes. Is it? I think because staphylococcus, streptococcus can also cause pharyngitis.
Yeah, I am. If you found due to skin lesion, okay,
Yeah.
like you will find it related to the drainage lymph node. If it is in the leg, you will find it in the groin. But to find lymph node in the other area, like upper, either you have this in type also in the upper limb, or you have something in the throat. You must take, because generalized lymphadenopathy can be different also. If you find generalized lymphadenopathy, either infectious or malignancy or TB or like that, it is very important. Okay. Good. So your provisional diagnosis is
Post-streptococcal acute glomerulonephritis with hypertension secondary to impetigo.
good. Very clear message. Continue.
Okay, so points 4 are the edema. There is history of infection by streptococcus, which is impetigo. There is tea-colored urine, oliguria, and also hypertension. So for differential diagnosis, nephrotic syndrome. The first one is nephrotic syndrome because she presented with edema, facial puffiness, periorbital edema, and abdominal distension. There is also oliguria. Points again, there is no frothy urine, there is tea-colored urine, there is history of impetigo, and there is no leg and ankle edema. For urinary tract infection, points 4 is dysuria and fever. Points again is no urgency and frequency and no lethargy. For systemic lupus erythematous nephritis, points 4 is facial puffiness, hematuria, hypertension. Points again is no malarish and no muscle pain or joint pain. So that's all from me.
Okay. Continue.
Yes.
Okay. So, next. So I will explain about the acute glomerulonephritis. It is the specific set of kidney disease in which immunological mechanism will trigger the inflammation and proliferation of the glomerulus. And it is an abrupt onset of one or more features of acute nephritic syndrome, which characterized by edema, macroscopic or microscopic hematuria, hypertension, azotemia, which is the increasing level of the nitrogen containing compound in the blood, and also oliguria, which is reduced urine output. So the relation with the case, this patient presented with facial and periorbital puffiness, so we can indicate as edema, and the tea-colored urine, which may indicate hematuria, and this patient have stage 1 hypertension. Next. So the etiology, as doctor said, the most common one is the post-infectious acute glomerulonephritis, and the most common of the most common is the post-streptococcal infection. It is common at the age of the 6 to 10 years old. So just now I said about the this AGN is the specific set of the kidney disease. So kidney disease in which due to immunological mechanism is such as Schönlein purpura, IgA nephropathy, and also lupus nephritis, SLE. And other etiology is also due to subacute bacterial endocarditis. Next. So investigation, we should do urine analysis and urine culture, and we can expect patient have hematuria, proteinuria, which usually nephritic syndrome, the trace is 2 plus. If there is more than 2 plus, it may indicate nephrotic syndrome. And then RBC cause, especially for AGN, and pyuria. Pyuria, which also the increasing level of the white blood cell in urine. For the microbiological test, if we suspect streptococcal infection, so we have to do ASO test, and there's increasing level ASO test in streptococcal infection, and if available, we can do antidenase B, also the same as the ASO, but better serological marker, especially for serological infection. If there's streptococcal skin infection, we have to do skin swab. And the full blood count, since this patient presented with hematuria, so we have to look for any anemic sign and also leukocytosis in case of infection. For the serum complement level, there's a low level C3 level, especially at the onset of the symptom, and may return to normal after 3 to 4 weeks. For the C4 level, usually normal in post-streptococcal glomerulonephritis. For the immunological markers, just now one of the etiology is SLE. So we have to, in order to exclude SLE, we have to do anti-nuclear and anti-dsDNA antibody. And there is also NK. If NK is positive, NK is anti-neutrophil cytoplasmic antibody. If NK is positive, so it may indicate Wegener's granulomatosis or polyarthritis nodosa. Next. For the renal ultrasound and biopsy, this is not the definitive investigation for glomerulonephritis, but if you want to look for any atypical presentation or complication of the glomerulonephritis itself, and or if the patient had prior history of renal disease or family member who had history of nephritic features. So we can do renal ultrasound and biopsy. And also, if the symptoms is prolonged, so we may do renal ultrasound and biopsy also. Next. For the treatment and management, so we manage the patient by strictly monitoring the fluid intake, urine output, daily weight, and also BP of the patient. And we can prescribe we can give penicillin 5 for beta hemolytic streptococcal infection. And if patient have poor compliance with penicillin, so the alternative one is erythromycin. And we have to restrict the fluid until diuresis and BP is controlled in order to control edema and overload of the circulation, fluid overload in circulation. And then if the patient have stage 1 hypertension, so we may prescribe diuretics such as furosemide. And if the patient have signs of the complication in AGN, such as pulmonary edema, so we can also prescribe diuretics. Next. Like I said, we have to look for the complication and treat the complication. One of the complication is hypertensive encephalopathy. So we can manage by managing the hypertensive state of the patient. And then pulmonary edema. First, we can supply oxygen. If necessary, we can ventilate the patient. And then we prescribe furosemide, restricted the fluid for 24 hours, and dialysis may be considered if patient have no response to diuretics. And then last complication is the acute renal failure. So fortunately, this patient do not have any complication at all. Patient do not present with any hypertensive encephalopathy signs and also signs of the renal failure. I think that's all from me.
Okay. Is there any OSCE or no?
Yes, by Akmal.
Yes, doctor. Wait, I'm trying to present. Okay. Okay, can everybody see my slides? Okay, if can, let us start. Okay, question number 1. Name the following skin condition. Can I have Aiman to try?
This condition. Impetigo.
Okay, yes. Okay, are you sure?
I'm quite sure.
Quite sure, okay. Okay, we save that later. We will continue one by one and I will show the answer at the end of discussion. Okay, question number 2, name one common causative agent of the skin condition. Can I have Umaira to try?
Streptococcus.
Okay, more specifically?
Group.
Huh?
A group Streptococcus.
Okay, group A strep, okay. Apart from that, do you have any idea what else? No? Okay, it's okay. Okay, question number 3, what is the complication of the condition? Can I have Sufiana to try?
Scarlet fever.
Okay, what else?
Cellulitis.
What else? Well, we just discussed that condition just now.
Post-streptococcal glomerulonephritis.
Okay, yes. Okay, thank you so much. Okay, so all of them get correct. Okay, and for question number 2 just now, apart from group A beta hemolytic streptococci, Staphylococcus aureus also can cause the following presentation, the skin presentation of impetigo. Okay, and another thing that we almost forget is the Staphylococcus scarlet skin syndrome. Okay, if the impetigo is caused by Staphylococcus. Okay, next, question number 2.
Staphylococcal are very, very important. Please take care because it causes many one. This one is SSSS, and also it can cause staphylococcal shock syndrome and then many complications of staph. That's why sometimes it will go beside the blood culture. If you suspect it, will do swab from the wound itself and ask for rapid gram stain and like that, it can guide you. Okay.
Thank you, Doctor. Okay, next. Question number 2. What is the common presentation of acute glomerulonephritis? Siapa lagi okay, who want to try?
I want to try.
Okay, Aiman.
Hematuria. Hematuria.
What else?
Hematuria, proteinuria.
Okay, what else?
Another person.
Okay, another. Who want to try? Who else want to try?
Periorbital edema.
Okay. Okay, good. Thank you. Okay, we will see the answer afterwards. Okay. Okay, next. Name one investigation to confirm recent streptococcal infection. Okay, so
Anti-streptolysin O test.
Okay. ASOT, thank you. Okay, apart from that, other than ASOT, what else can we do to confirm recent streptococcal infection?
Culture?
Yes, culture. Okay, thank you. So all of them get correct. Okay, last question. Okay, this question I found it in internet. It is quite interesting, but I'm not sure whether it is valid or not. So let us discuss together. So for the histological finding, in this for PSGN, okay, what 3 clues that we can find is there is enlarged and hypercellular glomeruli. Okay, there is diffuse mesangial cell proliferation with increase in mesangial matrix, and there is presence of PMN leukocyte. Okay, that's all from me for OSCE. Thank you so much. Assalamualaikum.
Alaikum salam rahmatullah. Okay. So again, which is a very important, as we spoke before with Athira, it is sometimes you're building up skills because your value is dependent on your skills. And hoping, inshallah, you are starting strong, hoping this COVID will not make you late anymore. Every day will count for you. It is not just a simple puffiness and edema, either nephritic or nephrotic. And even if we came to the diagnosis itself, like nephritic or nephrotic or whatever, there is a lot of subtitle important points. That's why subspecialty are very important. This time we are aiming to have a lot of subspecialty, or country is calling for a lot of subspecialties, which can do the best job. Hoping, inshallah, you just arrange your matter of thinking and future to give benefit to the country through subspecialty, not to run hurry for money or like that. Please try to continue your pathway to good subspecialty as early as you can. It is the top important for both patients and the country. Okay, good. It is a nice case, but as I told you, if you see any disease, remember that it has a root and a fruit. Any disease can have a root and a fruit. The root may be here, it is glomerulonephritis due to post-streptococcal. But if you went to Japan, it may be the most common one is IgA nephropathy. If you went to another area, it may be another infection causes. So you must consider what is the cause. It is the same if it is nephrotic, it may be primary or secondary. Secondary to what? You will go through a big list of cases like HIV, like hepatitis, like systemic lupus erythematosus, like some drugs, like some malignancy, okay? So this is the most important. What is the fruit? I mean the complication. So you must suspect the complication. Here, we are afraid from hypertensive encephalopathy, very important, from fluid accumulation. We are afraid of sepsis and septicemia, which can go through the microbe also. And the most important, is there any affection on the kidney or not? That's why I would like to do counseling myself with one of you who can raise his hand to counsel him. Is it Maria? The most smiling one.
Oh, okay.
Okay, so Maria, now I would like to ask you if this child got glomerulonephritis, what is the prognosis for it? Suppose I am now the father of the patient, what you are going to tell me?
It has good prognosis. What else other than prognosis should I tell?
Yeah, what is the prognosis of the child with glomerulonephritis?
And the prognosis is good. The the mortality is lower than 0.5%. However, there is a long-term outcome. The children may develop chronic kidney disease, but only below 2%. Yeah, so the child we will refer to the nephrologist for more evaluation and management. What else you want to know?
I know I need to know what is the book you are reading from it. The most important is to try to, you must introduce yourself, you must ask me what I know about the case, okay? And then come to the conclusion, okay? Yes, we are right that the prognosis is good, but the word however, or but, or like that are very important. Number one, we need to follow up the patient for up to 1 year. To follow up, number one, his blood pressure is adjusted or not. Number two, is there any occult hematuria, because it may stay for up to 6 or more months. Okay, and follow up the renal function. In spite, she said the mortality is 0.5 and the recurrence or like that is very low. Even the kidney injury can be less than 3%, but it is very important for us to follow up the patient. So how you are able to tell the parent that prognosis is good and I need you to stay with the follow-up with 1 year? This is the issue of you. You must be a good in social contact. You must be able to give the message to the patient. The patient doesn't know. So you must come from the start, ask him what he knows and build up. But we must tell him there was some inflammation in the kidney, in a part of the kidney knows glomerulonephritis. It is an infection. And this one, hopefully, we define the cause, which is infection by one microbe known as blabla. We already give treatment to eradicate, but we need to follow up the patient for at least 1 year. In spite, the results are very good, but we must pick any problem bit early. So we will not say, Alhamdulillah, my son okay, cured goodbye and I didn't want to come to the hospital again. Okay, that is the issue. A good communication and a good understanding. If you said to me it is a good only, I will alas really relax. Hospital. Hope you got now a good points about cases like fever or rashes or pyelonephritis, and we
I'm sorry, doctor. Sorry, doctor, we can't hear you.
our session. Okay, no issue. Hoping you could benefit from our session today, inshallah, and see you again for inshallah for another teaching. Don't forget to send me the glomerulonephritis presentation. It may be good guide for other group. After you complete it, please, all the presentation of it. For Athira, first, I would like also to thank the group for that nice presentation. Athira will get 8. Okay. Thank you. Assalamu alaikum wa rahmatullah.
Waalaikumsalam. Thank you, doctor.
Thank you, doctor.
Thank you,
Thank you,
doctor.
doctor.
Keep safe, please. Take care. Assalamu alaikum wa rahmatullah.
Thank you,
Okay,
doctor.
doctor.